Do you frequently feel like your heart aches sometimes? Well, it might not be your heart. It could be that your body is tired, your throat hurts, and you just can't shake off that fever. What if I told you a tiny virus, something you can't even see, is throwing your whole system off? That's often what happens with infectious mononucleosis, also known as mono or the kissing disease. Think of it like a body-wide sabotage by a sneaky virus. It hits teens and young adults hard, especially when they're stressed or not sleeping well. Have you ever been so tired that even after 10 hours of sleep, you still feel worn out? That's mono waving hello. So what causes this sneaky illness? The main culprit is a virus called Epstein-Barr Virus, or EBV for short. Imagine it like an unwanted guest crashing your body's party. It spreads mostly through saliva, so sharing drinks, kissing, or even coughing near someone can pass it on. Let's say your friend takes a sip from your water bottle, then gets sick a week later, could be EBV. It's not spread by touching doorknobs like a cold, but more like sharing personal items. Once inside your body, EBV loves to hide in throat cells and white blood cells, where it starts multiplying without you knowing. Scary, right? Most people get it by adulthood and don't even realize, kind of like getting a stealthy badge from your immune system. How do you know if EBV is the problem? Let's play detective. Common clues: sudden fatigue, like you're dragging bricks in your shoes, sore throat that won't go away, worse than a cold, fever, and swollen glands in your neck. Some people even get an enlarged spleen. That's the organ on the left side of your belly. Have you ever been told not to play sports when sick? That's because a swollen spleen can burst if hit, so no basketball for now. Other signs: headaches, loss of appetite, or a rash if someone accidentally gives you the wrong medicine, like amoxicillin. If you've been feeling off for weeks with no clear reason, EBV could be the hidden cause. To catch the virus, doctors play virus detectives. They start with your symptoms and may do a blood test, like a photo ID check for your immune cells. One test, called the monospot, checks for special proteins made when fighting EBV. But it's not perfect. Sometimes it says no even if you have it. So doctors might do specific EBV antibody tests to confirm. Now treatment: no antibiotics, those fight bacteria, not viruses. Instead, it's all about rest, fluids, and letting your body fight back. Think of it like recharging your phone battery. You stop using it until it's full. For pain and fever, acetaminophen or ibuprofen help. Gargling salt water, great idea, like giving your throat a mini spa. Most people get better in 2 to 4 weeks, though tiredness can linger. There's no magic cure, just time, patience, and self-care. Can we stop EBV before it starts? That's tricky. There's no vaccine yet, though scientists are working on it. But you can be a smart defender. Avoid sharing drinks, utensils, or toothbrushes, even if your friend says just one sip. Think, would you let a stranger lick your spoon? Probably not. Kissing, well, that's a big root, so be mindful, especially if someone's been sick. No, you don't need to live in a bubble, but small habits help. Also, boost your immune system. Eat well, sleep enough, manage stress. Think of your immune system like your phone's security system. Keep it updated and charged. Exciting news: scientists aren't giving up. Recent studies are testing vaccines to stop EBV before it starts. One idea is to train your body to block the virus before it enters cells, like putting a lock on the door. Other research shows EBV may link to long-term health issues, like multiple sclerosis (MS). That means stopping EBV might prevent other diseases too. Cool, right? Also, new blood tests are being made to catch EBV faster and more accurately. Imagine a rapid test like a COVID kit, but for mono. All this work could one day make kissing disease a thing of the past.